Panaritium. A few months ago, I woke up with a sharp pain in my left toe, classic panaritium. The toe was inflamed and too painful to touch. I didn't consult a doctor, which I don't recommend you do, because I have a reliable helper at home, a bioresonance therapy device, BRT. If you don't have such a device, you should see a doctor immediately. Even with the device, treatment wasn't simple and turned out to be quite lengthy. I'm still using a set of therapy programs to address the condition. Perhaps I'm being overly cautious, but I continue the treatment even though all symptoms have disappeared. What is panaritium? Panaritium is an acute infectious inflammation of the tissues of the fingers or toes, most often caused by bacterial infections such as Staphylococcus aureus. The condition may lead to pus formation and requires timely treatment to prevent serious complications. Causes of panaritium. Panaritium occurs when pathogenic microorganisms penetrate the deep layers of the skin through minor injuries, such as cuts, insect bites, abrasions, splinters. Additional risk factors include poor hygiene and conditions that weaken the immune system. Symptoms of panaritium. Clinical manifestations may include sharp pain in the affected finger or toe, swelling and redness, general symptoms of intoxication, such as fever and headaches. Types of panaritium. Panaritium is classified based on the depth and location of the inflammation. Cutaneous panaritium, inflammation on the surface of the skin. Panaritium around the nail, inflammation around the nail plate. Subungual panaritium, inflammation beneath the nail. Bone panaritium, involvement of the bone in the inflammatory process. Articular panaritium, inflammation of the joints of the finger or toe. Treatment. The method of treatment depends on the stage of the condition. In early stages, conservative treatment with antibiotics and physiotherapy may be effective. In cases involving abscesses or deeper forms, surgical intervention may be necessary to drain the pus. Prevention. To prevent panaritium, it is recommended to maintain proper hygiene. Promptly treat minor skin injuries. See a doctor at the first sign of symptoms. Timely diagnosis and treatment can help avoid complications, including the risk of blood infection. Common pathogens in panaritium. Staphylococcus aureus, the primary pathogen, often entering through minor skin injuries like cuts and abrasions. Streptococcus pyogenes, less common but also capable of causing inflammation. Escherichia coli, occasionally associated with infections, especially through contact with contaminated objects. In some cases, mixed infections involving multiple microorganisms can occur, complicating diagnosis and requiring a more comprehensive treatment approach.